And action. All right, everybody. So this is Dr. Rick's Minute Clinic, and I wanted to let you know about Ashley's question. Ashley sent in a question. I've seen patients who have a legitimately low-calorie diet, 1,000 to 1,200 calories a day, that is, with high fruits and vegetables and balanced macronutrients. They still do not lose weight. Why? What else is going on? What tests should be run? What questions should be asked? So good idea, Ashley. In fact, because she asked that question, she is getting a gift card to Fruitful Yield. I'll be sending this out in the mail, Ashley. So if you didn't attend the lecture, we talked about this with the panel that I had. I'm going to try to make this really short. The idea is everybody should be able to bring down weight with that kind of practice. That's really tight, actually. And one of the questions, or at least one of the answers from the registered dietitian was, that might be too tight. So you would think that if you're really restricted on your food, your intake, your exercising, and you didn't tell me whether that guy or that person was exercising, but you would think weight loss would come, but it doesn't always happen that way. That's why it's always different. So as the registered dietitian, Kate Olson, said, that might be too tight. So if it's too tight and then you go and exercise, you're actually going to hit the wall because you don't have enough calories. So it might take a little experimentation, maybe 2 to 3 months of opening up, maybe taking in 15 to 1,600, or at least ask the registered dietitian or your nutritionist about maybe adding that in the form of protein. I think protein in the daytime, at lunchtime, and carbohydrates, healthy ones at night, would be the option for me, especially when it comes to satiety, that mindful practice that tries to get you to relax. Well, satiety can do the same thing. So if you don't have a registered dietitian, you might want to follow my videos on nutritionist and or get somebody in your area. DrRic.org is a great website for the American Academy of Dietetics or something like that. But you can probably find a registered dietitian in your area by going to that website. The other options are if we have medical disease and that patient hasn't been seen. I can tell you that in the last 2 days, I've had 2 patients that came in for wellness exams. But during the wellness exam, one had a BMI of 44, the other had a BMI of about I think she was about 30 plus, 38 probably. But if you followed my video on BMI, that's way too high. And when a doctor, that's what they told me, when the doctor that they went to before says, no, everything looks good, obviously not everything looks good. So if the regular blood tests are okay, then we go to the next stage. You don't just stop there. I get deeper into thyroid evaluation, deeper into cortisol or adrenal evaluation, adrenal function, and deeper into how the ovaries are working. If you get a good jive between those 3 organs and the brain, then that's good. We can push that aside, but in my opinion, not that many people do that, doctor-wise. So ask, or at least try to find a doctor that does that, maybe an endocrinologist, or come to see me. Maybe you can do that with your chiropractor. Sometimes you can order blood tests or saliva tests through the internet, but that'd be the first thing, is to look for dysfunction somewhere. That'll be holding you up. Other thing, mood is always going to be part and parcel of this thing. So if you have a patient that's going through a rough time, even if you're as tight as you are with 1,000 to 2,000 and you're exercising, sometimes the emotion here will cause poor sleep, or just the emotion by itself will be enough to make the body think it's in starvation. And it's going to try to extract every little calorie out of everything you eat. So you can eat like a bird but still gain weight or still be plateaued. So mood has to be evaluated. That's usually by a psychologist. So I'll try to put this online. If you look at the talk portion of my weight loss program that the psychologist gave, might give you some possibilities. Finally, again, I mentioned it already, but sleep is so important. You can't overtrain. Well, I guess you could, but if you're overtraining, you should have somebody tell you what you should do to change that. But you can definitely undersleep. Even if you can perform, do your job, get through the next day with a Red Bull and 3 cups of coffee, that's not right. It has to be luscious sleep, has to be refreshing sleep. You should be able to wake up without an alarm clock. If you're not feeling that, you might have to ask your doctor. Maybe a sleep study would be important for restless leg or sleep apnea, or just might have to get some coaching from your psychologist or primary care doctor. So hopefully this little bit helps, but I think that is way too tight. I like what you're doing as far as the registered dietitian thing, but hopefully the doctor can advise on the next step from here. This is Dr. Rick's Minute Clinic.